All right. Hello, everybody. Thank you so much for joining us tonight for the Doctorate of Audiology virtual information session. My name is Tom Kresh. I'm our Director of Graduate Admissions here at Commonwealth U. I appreciate everybody taking time out of their busy schedule to join us tonight. There's a lot of other things that you could be doing, and you're choosing to spend your time with us to learn more about our Doctorate of Audiology program. The event should take probably around 45 minutes. This is being recorded, so whether you're watching live or watching the recording, thank you for joining us, and please don't hesitate to contact Dr. Zaleski or myself. We are certainly happy to help in any way. And this event should be a great opportunity to learn more about the program and also help you preview your experience in our doctorate program. But before we go any further, Dr. Zaleski, would you mind introducing yourself?
Sure. I'm Dr. Zaleski. I am the graduate audiology department, or sorry, if I can speak, I'll be fine. The Doctor of Audiology program coordinator. So that's who I am at this point. So those of you that are applying or have communicated, you probably have received some information from me. So welcome, everyone.
And Dr. Zaleski, what was your path to Bloomsburg? How did you end up here?
What, teaching wise?
Yes. Yeah, teaching. And do you have an area of research or?
Yes, my path to Bloomsburg. I am actually a graduate of Bloomsburg, undergraduate, and the master's program back in the day before you needed the doctorate. So yes, I'm from that old. So I went out and I enrolled in a doctorate of audiology, or sorry, a PhD program, and I had to do some teaching and during the teaching, I'm thinking, okay, where am I going to teach? So I reached out to my old chair and said, do you have anything to teach? And he said, sure. You like vestibular, you do vestibular stuff. I'm like, yeah, because I hate it. I have a course. So I taught that for, just come up and teach that for him. And then out of the blue one day, I got a announcement in the mail that there's a position opening and applied, and 26 years later, here I am. So my area of expertise is auditory processing and tinnitus. However, having worked clinically and still do things clinically, I have done a lot of different things and interest in all aspects of audio testing, basic testing, advanced testing, hearing aids. But my real expertise is auditory processing and tinnitus.
Excellent, excellent. Thank you for that. And we have a great presentation here. I want to go ahead and share my screen and we can get this kicked off. So again, welcome everybody.
Yeah, welcome everyone. As was said, this is the Doctor of Audiology virtual session. Our program has been around for a long time. So this isn't a new program. It's been initiated since, or it's been in existence since the 60s. And throughout the 60 years that the program has been up and running, there's been changes to the scope of practice and the requirements. And as that has gone on, the program has changed also and added and grown. And most recently is the Doctor of Audiology program, as well as integrating the interoperative neurophysiological monitoring program. So we've been around for a long time. We've been through all the growing pains. We think we have a very good course sequence set up, and so we have a pretty good program here. And the nice thing about it is we're well known. A lot of places, because we've been around for so long, a lot of places have our graduates or know of our graduates, and so all those neat things, whether a less experienced program. So if you want to go to
Yeah,
the
the
next slide.
reputation oftentimes precedes itself, when you think of Bloomsburg, this is probably one of the first things you think of. This is, in nursing, some of our other, programs. This is among the things that puts us on the map, so I think, you can rest assured that you're stepping into a place that's, pretty hallowed ground for audiology and communication sciences and disorders. But that's a great point. Thank you.
So we'll talk a little bit about the program. Our program does emphasize clinical training. You get the didactic aspect in the classroom. And the nice thing about it, we do have our on-campus clinic, which allows students to put into practice what they're learning in class. And that's the nice thing about that. So that's one of the things I like also having supervised through the years. You're able to say you see things in class. Remember last week we were talking about this, that, and the other thing. Here it is. And students like, oh yeah, there it is. And so that's the nice thing about it. So it allows you to do it, see it right from the beginning. So if you go to the next slide. Overall, our program, it is a 4-year program. Really, the fourth year, it's really 3 years. Yes, it is technically 4 years, but in actuality, it's 3 years because 3 years, the first 2 years, you are on campus taking the foundational courses and developing those foundational clinical skills. And that's what really sets us apart from a lot of other programs. Some other programs, students may not get any clinical experience to the second or third or even the fourth year. Our students are in the clinic from the very beginning, first semester. And uh, and that's why a lot of sites love our students because it's one thing having the theory, it's a different thing putting into practice. And so our students have that foundational skill, so they don't have to spend the time working on those foundational aspects. Then the third year focuses on expanding your clinical skills and knowledge. You still take classes but you're off campus 3 days a week within 2 hour radius of Bloomsburg to get experience in hospitals or private practices, physician offices, clinics. And then the fourth year is a full-time off-campus experience, which students can complete any place within the country. We have placed students in California, Washington State, Texas, Michigan, Ohio, Florida, Georgia, Virginia, West Virginia, Maine, New Hampshire, New York, New Jersey, obviously. So we've placed students all over the place. That's the nice thing about it. The other aspect of our program, we have 2 specialty tracks that students can decide if they want to pursue. One is the research track, which allows the students to complete an independent original research project under the direction of a faculty member for their dissertation. And the other one is the interoperative neurophysiological monitoring specialty track. We are one of the few programs in the entire country that offers the interoperative neurophysiological monitoring program. So it is a neat, unique experience. There are some programs out there that say they offer it. They might have maybe a class or two at most. We have 4 additional courses that students take, as well as specific off-campus experiences, so students can get the appropriate on-hands training that they need.
Yeah, and we will have a separate virtual information session for the IONM program in November. So for anyone who's watching who may be interested in this, and again, this is pretty unique. Like Dr. Zaleski had said, you're not going to see this in most other places. And like Dr. Zaleski said, IONM is a subspecialty of audiology. So it's a nice complement to the doctorate program. Absolutely.
All right, so the nice thing about it is our achievement data is strong. All of our students complete, all of our students are employed. Actually, most of our students have jobs before they even finish their fourth year. A lot of students get offered positions at the location where they complete their fourth year. So it's not like they're struggling to find a position. And then we have almost we have essentially an 87% pass rate on the praxis. So that's the national exam. students have to take in order to get licensed and certified. So we do have a strong program, and we're, we are proud of the numbers that we do have. So why Bloomsburg program? Well, as we said, you're going to get hands-on experience your first semester. We don't always like to say to students, we don't feed you to the wolves. We will allow you to get some training, and you have to pass some competencies before you have to do it. But really, from day one, you are in clinic. You will be observing other students, the second year students, to start learning the process and how things are done and the way things are done, the paperwork and all those things. And eventually it transitions over to you seeing some patients as we do these things. We also have one of the things that I always like to say, audiology, we have lots of toys. That's what makes it so expensive, because our toys are expensive, unfortunately, but you need it. Between our vestibular lab with a video nystagmography, a rotary chair, posturography. A lot of programs do not have rotary chairs and posturography. So having that experience is really gives you a leg up. In addition, our electrophys testing of ABRs and electrocochleography, as well as we also have we're working on developing even more a simulation lab where we have what's called an audio carl, where essentially it's a bust of a genuine of a human, where you can put headphones on and you can program in an audiogram and test the person's hearing, and the audio carl responds like a regular patient. So you can do that. We also have a otosim, which is a simulation otoscopy training piece of equipment to help students master the skill of otoscopy and be able to identify a lot of different pathology. So we have a lot of toys on in our departments. As I said previously, we do have our on-campus clinic, where essentially you are putting into place all of the theory that you're getting in the class. So that's the nice thing about it. Also, students get the opportunity, because it is a fully functioning clinic. There's electronic medical records, there's discussion on billing and insurances that you have to meet, and being able to make sure you're in compliance with certain insurances, what you have to do to get the patients covered, services covered. So as well as things you gotta managing the business, making sure you have supplies and those types of things. So that is the nice thing about having an on-campus clinic. Again, talking about the IONM program, it is a nice little, if you're interested in that, is a subspecialty of audiology that gives students the opportunity, if they're interested in it, to pursue that avenue and to pursue the IONM world, if that's what they pursue. We'll talk a little bit more about that later. And as I just said, we have everyone completes the program and everyone gets jobs. So that's the biggest thing about it. So, and that's a credit that a lot of places love our students, because they are well trained. They have that foundation on to build on and to grow, and that's really the important aspect.
Yeah, and for anyone who's interested in learning more about the instrumentation or the on-campus clinic, there is a video tour on the Audiology website, and we have a student experience photo album where you can see, what these things look like, and try to preview your experience and what that might entail in our audiology program. But again, that is available on demand on website.
We kind of address this also, but quickly go over it. Our first and second year students are on campus, taking 3 courses, and then 1 class or part-time experience in the on-campus clinic, usually 1 half day a week. Third year, again, you're taking 3 classes, but then you're off part-time, getting 3 days experience. And then the fourth year is a full-time off-campus experience. And so basically what happens is that first and second year getting the foundation in order to grow and build. Third year is expanding upon that knowledge. First and second year also, you're developing those foundational skills and abilities that audiologist needs. Third year, you start expanding upon those, and fourth year, you're off, like I said, any place within the country with clinics or hospitals or physicians' offices, private practices, to further refine and develop your skills to really evolve into a high quality, competent, independent professional. Um, Again, we have essentially 3 tracks in the program. One is the traditional track, which we will go over what that all entails. And the other 2 tracks require the students to complete the traditional track also. So it's not like, oh, if I do the research or IOM track, they do something else. No, everyone has to complete the traditional track. So that's the core of everything. Then the research track is, as I said previously, students can complete an independent research project under the direction of a faculty member that leads to the dissertation, defenses and all of those things. The IONM track provides the theoretical foundation for students to understand the entire process of IONM, what has to go on and how things are done, the equipment that is used, the testing that is done. And then we do have a contract with a company that provides interoperative neurophysiological monitoring where students go to complete their clinical experience during their third and fourth year if they are so choose to do that, right? Because we do have some students who want to take the coursework, but they don't want to do the clinical aspect, which is fine also. So those are our 3 tracks.
Yeah, the opportunity for personalization is nice too. You'll be able to walk away from this, looking with the curriculum that was almost kind of tailored based off of the students' interest. And that gets us to year 1 coursework.
So here's the year 1 coursework. Again, as we talk about, you can see the beginning, the first 3 are the courses that you take, and the last one's the clinical experience. And you can see how things grow. You can see from the fall, there's diagnostic 1, teaching the bread and butter of basic testing, getting hearing aid theory, and then introduction to IONM. So students get a background on that. And then during the spring, you can see, then we talk about hearing science, getting some foundational information. Diagnostic 2 now builds upon looking at middle ear testing, admittance testing, and then we start getting into evaluation of balance issues, vestibular and balance systems, and basic testing. And then the summer, there's the research course, and then building upon those things, we have the masking course, and masking again is a foundational skill of audiology, and then how to test children, and again the clinical aspect as we go on. So you can see how it builds upon it. And then when we get into the second year, you can see it builds further upon the first year. So this first year is really the foundation of the program to give you those foundational skills to grow and build upon.
And we have 2 other panel discussions that we have on that are available on demand on the Audiology website that talk a lot about the day-to-day life as a grad student involved in you're enrolled in the doctorate program, what the courses are like, how you're managing a schedule, how it might be different from your experience as an undergraduate. And they did a really good job of illuminating kind of like, hey, this is what it's like, day to day. So if you're interested in learning more about that, those are a couple, on-demand tools I would use to explore the academic side of the experience. And then year 2.
And so year 2, you can see now we're building upon trying to expand something. So now in that fall, you have pharmacology. So when you're doing your basic testing, how do medicines and chemicals impact the results? getting some clinical neuroanatomy, because if you come here, you'll hear me say, if you know anatomy and physiology, audiology is really easy. Really is. And then there's a balance too, looking at the rotational chair, posturography aspects. Then we get to the spring. Now you've had the theory of hearing aids, and now we're going to be talking about the clinical implications and the fitting aspects. So you've had some experience from those aspects. Then there's going to be the neuroscience course, and then there's going to be the electrophys course. So students can do those ECOGs and ABR testing and long latency, have that foundation to go on. And then we get to the summer, there's expanding upon, building upon those foundational skills and abilities, looking at tinnitus, evaluation and treating of tinnitus, same thing with central auditory processing, evaluating and treating it. And then the counseling course, essentially the perspective and interpersonal implication of oral rehabilitation is a counseling course. As I often say to people, audiologists are not counselors. However, we do a lot of counseling. And so that's why we put the counseling course in, so students have that foundation and know the different theories and perspectives on how to do that. And again, you can see there is, at the last one is the clinical experience on campus. So that's year 2, building upon it.
And Dr. Zaleski, I've heard you mention this before, that one of the clear differences between the speech language pathology and audiology is going to be more of a medical science based program, whereas speech language pathology, there's going to probably be more counseling. It's more of a human services type function. Is that accurate?
To an extent, audiologists are more like diagnosticians. We are having a patient come in, we have to evaluate what's going on, and we are kind of like classified in that way. Actually, there's a bill working its way through Congress that will make us equal on par will make us providers that will be on par with nurse practitioners and physician assistants. So that will open up some other boundaries or avenues for us to do, where speech is mostly working from the perspective as therapists. They're doing one-on, so not so much counseling, but doing more of a teacher perspective, working with students one-on-one or in groups, teaching them to produce the sounds, or working on their swallowing or communication aspects from that perspective.
Yeah, scope of work sounds different.
Yeah, it is. It's slightly. So then third year, now you're going to see a slight change in how the curriculum, as you're taking notes, there is no more, diagnostic courses and fittings. Now we're expanding in working with patients and adding those additional aspects that audiologists do. So you can see for the fall, there is oral habilitation and rehabilitation course working with children, because children have special areas of concern that adults don't. There's a hearing conservation course, so audiologists are involved in hearing conservation and industrial audiology and a medical audiology understanding on how the medical world fits in, and when you see some diseases, what it indicates and what it means. And now in the spring, there's the adult oral rehab course. There's an auditory implantable devices, CIs, as well as bone implant devices, and electronics course. And then summer, there's an ethics and cultural diversity, the business course, and then working with geriatrics, because they also have special needs. Their body changes, as the body ages, how it responds and what it does changes, and also the medications that they're on can have an impact. All that comes into play. And again, there's that clinical experience all through the third year, that part-time 3 days off campus. And then fourth year, as I said, is the full off-campus experience. So basically, you are employed at another facility wherever you're at, working there full time, 5 days a week, 40 hours a week, like your regular employee, except you're finishing up the your clinical hours that you need to get licensed and certified. So the big question a lot of people have, what's the job market for audiology? Well, you can see it's pretty good. The Money Magazine, U.S. News say we are the 26th best healthcare job. The U.S. Bureau of Labor Statistics is saying there's a huge need, 11% growth over the next 10 years. So I actually saw something not too long ago that indicated that if all the professionals would retire, now who are eligible for retire, there would not be enough audiologists or audiologists in the training programs to fill that void. So there is a huge need, especially as individuals are getting older. And we also have the early intervention aspect going on. And those of you who know people, and you may also yourself using your personal listening devices and your earbuds that are way too loud, that's all job security for us. So all that leads to they need us, as well as you can see CareerCast says we're the 14th best job out of 200. So a lot of people are interested in this. Next thing is, are you gonna be able to pay your bills? Yes. When you get done. Right now, the median salary is about $87,000, almost $88,000. In Pennsylvania, that median is 90. So it's a little bit above, Pennsylvania's a little bit above the curve. Obviously, as you work and work your way through the profession, more and more people, your salary gets higher as you get through, as like anything else. So that's the nice thing about it. Okay. Let's talk briefly about the Intraoperative Neurophysiological Monitoring Program. Intraoperative Neurophysiological Monitoring Program is basically there you are part of the surgical team. And what you are doing is you're there to prevent injuries. And for a variety of surgeries, as you can see, from neural surgeries to vascular to ENTs, orthopedics, on and on and on and on and on. Simply because when someone is having a surgery, say neural surgery, and there's a craniotomy going on, and a physician retracts something, some of the neurons, they put pressure on and stretch some of the cortical aspects, which can then negatively impact where that sent to. So, for example, if there's something going on in the motor region and there's a problem, with the foot. So they can't wake the person up in the middle of the surgery. Say, could you wiggle your toes for me to make sure everything's fine? They can't do that. So what happens is the intraoperative neurophysiological technologists, they can monitor the neural transmission from the auditory motor strip down to the toes to see if that neurophysiological conduction is getting there. And so if it is, there's a less odds of a bad outcome when that's happening. And so what happens is because they do real-time monitoring, they're doing their monitoring while things are going on. And if they see a change, they need to speak up and say, whoops, something's changed. I had a reduction in my response. And now the surgeon has to decide, okay, let me retract this. Let me try to approach this from another side. Or, okay, let me stop and let's see what's going on. Or this is the only way I can get at it. I'll work fast and hopefully keep me posted if things change and see what happens. So you are an integral part of that surgical team. So that's IONM in a nutshell. Their course sequence, because we do have a separate IONM program that students can enroll in. It's a certificate program, post-baccalaureate certificate program. It is a 1-year program. So you can see it provides the foundation. Same introduction IONM course at the audiology. Then there's the evoked potentials, IONM spine, and then there's a clinical experience. Then in the spring, there's a neuroanatomy, EEG, and biophys, and then craniotomies and vascular surgeries. And again, another clinical experience in the summer is a clinical experience also. What happens is the AUD students will take, in addition to the introduction to IOM, the spine course, the EEG course, the craniotomy and vascular surgeon, and the evoked potentials and EMG course. So those are the 4 additional courses that they take. With it, they don't take the functional neuroanatomy because we have those courses in the AUD program.
And Dr. Zaleski, what does the program look like for the students that are enrolled in the Doctor of Audiology program with the IONM track? It's
what will happen is they will take one additional course, spring of their first year, fall and spring of their second year, and then fall of their third year. So they take 4 additional courses.
okay. So it's 4 additional courses on top of the 4 years. Okay.
Yep.
Okay.
Again, IONM technologists who just go through the IONM certificate program. They're well compensated. You can see the mean being almost $88,000. With a range of roughly 77 to 103. So it depends on where you're at and what's going on. I always like to let students know also at this point that some of the states, I know this, California, if you want to do IONM in California, you have to have your AUD. You just cannot have the certificates. Pennsylvania, you can have the certificates or you can have the AUD. However, if you have your AUD with the IONM, it opens up other avenues where you can be trainers or educators or supervisors. There are some states where audiologists can do remote monitoring, so they can sit at home. And again, you have to have your AUD to do this. They can sit at home and monitor multiple surgery. And there's the technologist in the class, or I'm sorry, in the OR. And so the audiologist communicates with the technologist who's in the OR, and they see something, they communicate to the technologist who then relays it to the surgery team. Without the AUD, you can't do that. So that's a separate pathway for us also. Application and admissions. The audiology, our application is managed by CIDCAS, which is Communication Science and Disorders Central Application System. So that's where you would submit it. If you're interested in just the IONM certificate program, their application is online through the Commonwealth University Graduate School. So you'd submit it through there. Both programs require a 1-page statement explaining why. I always like to tell students, you want to tell us why we should pick you over anyone else. So I always like to say, if I called up the phone, called you on the phone and said, we have 1 position left between you and somebody else. Why should I accept you over the other person? You're probably going to say, well, I have these skills, I have these abilities, those aspects. So that's the important thing. You want to tell us why you are a good fit for our program. You then need 3 letters of recommendation. We recommend academic ones because we're trying to make decisions on your abilities to complete graduate school. Okay. So the issue is, people, there's nothing wrong with requesting people if you work for somebody or a supervisor or a religious person. However, can they really speak to your traits and skills and abilities from an academic perspective that allows you to, be successful in a doctoral level program? And so that's what we're looking for, that type of information. We also are looking for a current resume to see what things you've done, as well as all your academic transcripts need to be submitted from all your schools so we can see how your grades are. The application deadline is February 1st. We do early admissions. So if you meet our criteria and you're a strong applicant, you can get offered well before the February 1st. And so that's something to keep in mind also. So the applications are now being taken for fall of 2025, so next year.
Dr. Selesky, one of the more common misnomers I hear is that you have to have a bachelor's degree in speech language pathology and audiology, or a bachelor's degree in communication sciences and disorders. Can you talk a little bit about some of some of the programs from an undergraduate degree perspective that would most
Sure.
prepare students for success?
Sure. When we transitioned to the Doctor of Audiology program, that is where it really started to change. Our governing bodies started saying, you no longer have to have that communication science or audiology, speech pathology, speech science background, because everything you need will be in your the AUD program. So we see and we have students in our program who do very, very well, backgrounds in from the sciences, from biology, from chemistry. And if you think about it, as I said previously, audiology is based in the sciences, anatomy and physiology. So having those backgrounds. So we have people who've been biology backgrounds, chemistry backgrounds, psychology backgrounds come through. We've had people who we had deaf and hard of hearing students. We've our deaf and hard of hearing majors, I guess I should say, as well as students who had hearing loss. Interpreting majors, education majors come through. So, but primarily we get them from the sciences. Most likely, I would say biology or even psychology tend to be the more common ones that we get.
Thank you.
Financial aid. Do you want to talk about this, Tom?
Yeah.
Or
No, that's fine. Yeah, so that gets us to financial aid. And one of the things that you probably are wondering is, what is the ROI going to be like for my degree? Similar to a bachelor's degree, you're looking at 4 more years. So you're looking at this, okay, is this going to be, hey, how am I going to pay for it? And B, is this, will I get a good return on my investment? I think Dr. Zaleski talked a lot about what the ROI would look like in your degree, which it certainly looks like it'd be playing in your favor. One of the things I want to talk about, just from a very basic standpoint, is just the overall cost of tuition and fees, and the cost of living at Bloomsburg is going to be, whether you're in state or out of state, is going to be as competitive as what you would see anywhere else. Probably far more affordable, in fact, as compared to what you'd see anywhere else. Again, the cost of living in a town like Bloomsburg is going to be very, very affordable when compared to New York City or Philadelphia, or a big East Coast city, or the city period. So those are all things that are working in your favor. Is you're going to find good value in your degree before you even look out for financial aid, right? So one of the things I remember Dr. Zaleski saying too is, when you graduate, no one's really paying attention to where the degree is from. It's no, do you have the AUD? Is it accredited? And what is the program reputation? And that's where, we always start this presentation by talking off about, like, this kind of put Bloomsburg on the map in a number of ways. This is a program that is held in very high regard, and for good reason. So, Dr. Les, where did you do your doctorate degree at?
I started off at Columbia, and then there were some issues with the program, so I jumped down to NYU.
Mhm.
And what I always say is, when I first enrolled in the program, I was like, oh, what did I get myself into? Because here I am, a small state school guy going up and competing against the Ivy Leagues. And what I found was I had a better core education than people from Columbia and who are from Brown and from NYU who are there and Yale who are in the program. And that's one of the reasons why I came back to teach, to give the students that same opportunity that I have, that quality education that you can go any place and be successful.
Mhm. Right. And in your experience with graduates from our program, um, or in employers that are reaching out to you, are there, basically, do you feel like where the degree is from is as important as is it a successful candidate and are they well prepared?
No, it basically comes down to, can they do what I'm asking you to do?
Right.
I always tell when, many, many moons ago when I went out and did my interviewing after I was graduating, no one asked me my GPA. No one asked, obviously they knew where I was coming from. One person gave me vestibular results and said, interpret this, what would you do? Another person had me watch them do some testing and critique what they did. Another person gave me an audiogram and said, "What would you do with this person?" So people are not going to ask you, unless it's a graduate, what did you get from Zaleski's class? Those types of things. But for the most part, students, people are not going to ask you, what your grades are, and that they're more concerned. Did you finish the program? Are you licensed? Are you certified? And can you do what we're asking you to do?
Mhm. Right. So when you look at the value in the ROI for the Doctor of Audiology degree from Bloomsburg, it's gonna be as good here as it is anywhere else. It's gonna be tremendous. And I think that works to your advantage as a prospective student. We do obviously offer, as graduate students, offer conventional financial aid packages. I would say the primary form of financial aid for a prospective graduate student is going to come through the form of graduate assistantships. For those of you who may be wondering, a GA is how we, affectionately refer to them as. That is a part-time job on campus where students would work anywhere from 5 to 20 hours per week, and in return, we would cover part of the cost of their tuition and fees, somewhere between 3 credits and 9 credits, and they would get a stipend. So you get a paycheck every 2 weeks, and this can help offset the cost. Will also give you very valuable work experience. There are a number of GAs available in the audiology and speech language pathology program, but we also have GAs across our entire campus. So you're not necessarily limited to any one department. We have GAs in almost every department that we have here on campus at Bloomsburg. And then we do have the Schlaw Scholarship, which Dr. Zaleski, you talk a little more about that?
Yeah, Cindy Slotz, it's a faculty member who passed away from breast cancer now, probably close to 20 years ago, and her husband was also faculty here in some administration. She was in special education, and so they developed a scholarship in her honor for special education, deaf and hard, no, special education. Audiology and speech pathology. And so it emphasizes the traits that the Slosh family, especially Cindy, held near and dear to her heart, which was research, service, and then education. So those are the emphasis of the program, what they're looking for, and it's a $1,000 scholarship after like the first semester. So um, there is some GPA requirements and those types of things with that because again, they want strong students to continue to go on and be successful.
Yep. Yep. So from a value standpoint, from a cost standpoint, ROI standpoint, Bloomsburg has a lot to offer for sure. I got a little bit ahead of myself talking about graduate assistantships and some of these things I already talked about. You'll see a full listing of our GA positions. There's a section of the website that's there at the bottom that's dedicated to GA positions. And I would say the ideal time to look for a GA position is probably going to be, especially for GAs that would begin the fall of 2025, probably as we get into the early spring semesters when we'll start to post them. Now, you do have to have been admitted in order to apply and interview for a graduate assistantship. So for those of you who may be considering, or your Bloomsburg is on your short list, it's important to apply early So you can get reviewed per admission early by Dr. Zaleski, and the rest of the admissions committee, because then that would unlock the ability to be able to start to interview and apply for graduate assistantship positions. Dr. Zaleski, what do some of the GAs in your department do?
It varies. It depends on it. Some of them are involved in research. Some of them are involved with clinic, helping them manage things. Some GAs assist faculty with course preps, labs for their courses, grading some materials, updating materials, helping just keeping us organized sometimes. So it really depends on who you're assigned with.
Thank you. Thank you. And then again, you're going to be spending, likely 3 years, possibly 4, depending on where you do your externship at in Bloomsburg, right? So this is going to be a part of your decision that you probably want to factor in is what's it going to be like for me to live in Bloomsburg and be a part of, the Husky community. So our campus was ranked as the 3rd nicest campus in the state of Pennsylvania. There are hundreds of college campuses in PA. So to be ranked 3rd is something that's pretty impressive. By all means, do not take my word for it. We have a lovely virtual tour that's available on our website that you can take to help explore your campus or explore the campus. The dining services was ranked #1 in the state of Pennsylvania this past year. So there's a number of good places. We have Starbucks, we have Dunkin' Donuts, we have Chick-fil-A, Qdoba, Subway, bento sushi. So, a lot of good places to eat. And it's all going to be encapsulated in a very nice, close-knit campus community. I always describe like Bloomsburg and our campus as like a hallmark setting of a college experience. So it is truly very beautiful. And as a graduate student, you're going to have access to all of these things that I have listed here on the slide here. So the campus recreation center is right down the street from where Centennial Hall is, which is where the audiology department is located. There's a graduate student lounge in the library, which is also conveniently where the Starbucks is located too. You're going to have full access to health, wellness, and safety support. Same thing for diversity, equity, inclusion, and belonging. So you're going to be a part of our campus community. Now, obviously, you're going to spend a lot of your time in Centennial Hall. And if you listen to any of our current student or alumni panel discussions, they will tell you like you're borderline setting up a cot in Centennial Hall. But by the time you graduate in 4 years, you will be ready. But again, you're going to be a part of the Husky family. And I think you want to weigh that in, consider that as part of your, due diligence as you're looking at doctorate programs. So we will wrap up the live part of this. We're going to quickly move to a Q&A. So for those of you who are watching the recording, if you have any questions for Dr. Zaleski or myself, please do not hesitate to contact us. We work for you and we are happy to do so. So we look forward to hearing from everybody in the future. And thank you very much.